At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Good afternoon, everybody. Good afternoon. It is Dr. Pauline here with MedsPLUS Consulting, and we also have my fabulous partner,
Dr. Jennifer.
So, hey, everybody, we are so glad to be here today. It is Monday, February 24th, which means it is time for MedsPLUS Medical Minute. We want to thank you all so much for tuning in every week. We hope that this information is being valuable to you and that you're able to talk it and maybe start having conversations with your friends, with your family, with your healthcare providers, so that they can be aware that you are learning valuable information to help improve your health outcomes. So today we actually have a 2-4. So it is February, which means it is my birthday month. That's a holiday. It's Valentine's Day. That's a holiday. It is Black History Month. Holiday. But it is also American Heart Month. And this is the month where we really try to highlight and uplift things that involve your heart, your cardiovascular system. Many of us know that heart disease is the #1 cause of death in the United States. And so we really want to uplift just getting awareness out regarding heart disease, cardiovascular system, even your brain and blood vessels, everything that has to do with your cardiovascular system. And so we want to start today with one thing, and that is Hands Only CPR. And I actually just gave a talk about this at the Warrior Senior Center. So shout out to everybody in Warrior. Thank you for having me today. It was a really, really engaging conversation. But want to make sure that everybody is aware about Hands Only CPR. And so back in the day, probably when me and Jennifer were first learning CPR in pharmacy school, we learned, 30 compressions to 2 breaths and that whole thing. Now they have totally changed the way we administer CPR. So if you are out and about, or maybe you're at home and you see someone go down with either cardiac arrest or they're having a heart attack, but they're not breathing, you check their carotid pulse and you don't feel anything. Or maybe you check the pulse at the arm, you don't feel anything. What do? The first thing is you want to call 911. So you want to make sure that we all have our cell phones by us at all times. You want to make sure somebody around you calls 911. If you're alone with the victim, you call 911. Take that time to call 911 so that way EMS can be on the way to you. The second thing that you want to do is begin what we call CPR. So unfortunately, well, I guess not unfortunately, but fortunately, we don't need a lot of training. There are people who are certified in basic life support and CPR, but if you are out with someone and they go down, you want to push hard and fast in the center of the chest, because essentially you are doing the work of their heart. So hard and fast in the center of the chest. And I always like to use the song Staying Alive. So y'all know the song, staying alive, staying alive, staying alive, staying alive. That is the tempo that you want to use for your chest compressions. And when we were going through training, Jennifer, you may remember that we will go an inch to an inch and a half deep, those kind of things. That's all good. But if somebody is down, they are not breathing, or they don't have a pulse, hard and fast in the center of their chest, that's what you're worried about. Could you break some ribs? Absolutely. But I promise you, that person who is down does not care. They want you to keep their heart beating until someone comes along, a more qualified health professional who can take it the rest of the way. So just want to reiterate, if someone goes down, the first thing you do is call 911. The second thing you do is begin pumping with your hands, and you can, press your hands like this or do your hands like this, pump in the middle of the chest, hard and fast, to the song of Staying Alive. Now, I know that some of you young people may not know Staying Alive. So the American Heart Association has actually given us additional songs that you can use that can help you get the beat. One is Uptown Funk by Bruno Mars. So if you remember that song, Uptown Funk's gonna give it to you, and Uptown Funk's gonna give it to you, that will give you the tempo. Another one is Rolling in the Deep by Adele. That's one. Ice Ice Baby. That was from my era. So Ice Ice Baby. Dun 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 dun. Those are kind of the songs that give you the tempo of how to keep up with the chest compressions. So if y'all have any questions, please put them in the chat. We will see them and we'll be able to help get you started. So now Jennifer's going to talk about our next topic.
Hello, everyone. And yes, I'm going to talk about politics, something that we need to stay abreast of. And as a business owner, we are definitely in tune to those things that will be not only affecting us as a business, but affecting you as the consumer, as the patient. As this being Black History Month, I kind of reflect upon the things that were done to Black people in the past that has caused mistrust. One of those things we can think about Henrietta Lacks. We can think about Tuskegee experiment. As a result of those things, there were laws that were passed or implemented to protect us going further. Well, that's what, as a pharmacy community, we're trying to do, to pass 2 bills actually to help independent pharmacy owners as well as pharmacies in general. So you, the average consumer, can have access to your prescriptions locally, face-to-face, with a pharmacist to talk with, answer your questions, provide guidance, consultations, such as Dr. Pauline and I do every single day. So, in case you haven't noticed or you're not aware, some people in some communities throughout the state of Alabama, more particularly for us, the greater Birmingham area, have experienced a pharmacy closure. There's a pharmacy closure in south side of downtown with CVS that was on Claremont Avenue. There was a closure of a CVS pharmacy in Vestavia Hills on Highway 31. There is a pending closure for Walgreens in Midfield. And then there's also talk of Walgreens closing in Roebuck. So if you think about those communities, yes, there are other pharmacies, but now what will happen is the pharmacies that are now open, it will now be burdened with more customers to be able to fill the need for the patients that have to choose another pharmacy. So when that happens, then we talk about the staff burnout. We talk about inconsistencies with service. We talk about frustration on the patient side, and frustration sometimes to the point they may miss a dose. Doctors trying to get prescriptions called in, there could be delays. So those are the things that are very concerning to us, not only from the patient side, but as an independent owner operator as well. So many times when we fill a prescription, the main thing that we're looking for is that the insurance, and I'm pretty sure you would think this is fair, the insurance would reimburse us the costs that we have to purchase the medication. So those are some of the rights that we're trying to protect with this legislative bills that are coming forward. One is the SB 93 and the other is the SB 99. You don't need to necessarily remember that. And we will, after we post the link, put the information in. We want to be able to cause an outcry. You know, where's the outrage? If you weren't aware, now that you're aware, what can we do differently? And we know a lot of times if we say nothing, then we get rolled over. When America has a cough, some of its citizens have pneumonia. And a lot of times it's the underserved communities. So we definitely don't want that to happen. We are very pleased. Last week, the bills were brought forth and it did pass the House. We want it to go through the Senate. We don't want it to go to subcommittee. What happens when those things, what happens a lot of times is we get lobbyists, and sometimes information could be swayed a certain way. So if you have a question about it, please feel free to reach out to us. You know how to contact us, whether it's through the comments, direct message, whether you want to call us or email us. But we definitely want to make you aware of the big picture, and that's patient access. So when you see a big chain that's starting to close stores, a lot of times that has to do with profitability and how they can shore up what needs to be done, which makes perfect business sense. The flip side is the patient access, and what do we do from there? How do we protect that? And that's what we want to be able to do, as well as sustain and be here to service you as we have done the community at large. So, Pauline, did you have anything else you want to add?
Yeah, I definitely want to add that we are asking for your support. This is not just for independent pharmacies, although we are feeling the bigger burden of this issue, but this is for access to all pharmacies, including the larger chains. So we're asking you to contact your senator and ask them to support Senate Bill 99. Now, we would also like support for Senate Bill 93. But 99 seems to be more comprehensive. It includes not just a patch for what's going on, but what will be beneficial for pharmacy in the long term, so that we don't have to go back in a year or two and ask for additional measures to be undertaken. So what we are asking tomorrow, actually, the Alabama Pharmacy Association is planning a pharmacy walkout. So all over the state of Alabama, there are pharmacies who will be participating in a walkout. They will close their doors at 1 p.m. because, to our knowledge, the Senate is supposed to vote at 2 p.m. on this bill. So the pharmacies will be closing at 1 p.m. So between now, for the next 24 hours, if our Facebook family, our Instagram family, our YouTube family could contact your senator and ask them to support at a minimum Senate Bill 93, but really we want Senate Bill 99 supported so that we can continue providing the services that our communities need. Imagine what things would look like if you were to go to your local pharmacy to get your prescriptions and the doors were closed. That is what the walkout is signifying. When we want people to, when you're going to your pharmacy to pick up your prescriptions tomorrow afternoon and the doors are locked, we want you to get that feeling of what it would be like in the future if that were the reality. And that's why it's not to deny access to your medications. It's to prove a point. That feeling like, oh my gosh, my grandma needs her insulin, or my husband needs his heart medication and the pharmacy is closed. It's a reality that this is on the way, and we need these Senate bills to pass so that we can prevent this from happening in the future.
Yeah, excellent. Thank you so much for talking about the walkout. So there are a lot of pharmacies in the state of Alabama that have signed up, and yes, we will be one of them. There will be different variations of the walkout. Some will still be there to take care of your emergency needs, but the doors will be closed. Some will still be answering the phones, etc. So we definitely have our day planned for us tomorrow to make sure we don't miss anyone. However, if someone does need an emergency or has an emergency, we will be able to take care of them.
Absolutely.
So that's it for the twofer.
That's it for today. Yes, so we talked about a lot today. This Medical Minute went a little longer than we normally do, but definitely want to make sure that you all take care of your hearts. We would love to see the day when heart disease is not the #1 cause of death in the United States. And I also posted a YouTube video in the chat that shows you how to properly check your blood pressure. So if you have a home meter, which y'all know we say every home needs a home blood pressure meter. If you have a home meter, learn how to check your blood pressure properly. If you don't have a home meter, reach out to us. We do have a remote patient monitoring program where you may have access to a free meter and a pharmacist consultation once a month regarding your blood pressure readings. So if you'd like to know more about remote patient monitoring, definitely let us know. And again, we ask for your support for Senate Bill 99. We need to get this thing passed so that we can keep our doors open and keep serving the community. As always, we are your downtown pharmacists. We are proud to be here and absolutely honored to be able to serve you. We'll see you next week for MedsPLUS Medical Minute. Have a great week, everybody.
Bye.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.